Changes to the way the State Department of Health is sharing COVID-19 data will impact how active cases are actually calculated. So these changes are happening because health officials have learned a few things from the more than 150,000 cases in Tennessee since this outbreak started. That and new CDC recommendations have come down about how to best document what's happening right here locally. So breaking it down for us, 6 on Your Side reporter Madison Keevy. Madison, it kind of feels like the more we learn, the more things change.
Right? And that's actually what's happening. The Knox County Health Department addressed that very feeling in a statement today that these changes in guidance or what data is reported can sometimes be frustrating and a lot of the times be confusing, but it would be irresponsible for public health officials to ignore them. So when changes need to happen, they will as we know more. So with that in mind, let's talk about some of the state health department's changes. Now, inactive cases will be reported instead of recovered cases. This is what you see when you go to the State Department of Health's website. The numbers there listed on the top in green are updated compared to the day before. This is a visual example of what we're talking about because it shows the state's shift in focus from the total number of cases or hospitalizations now to a day-to-day change. But what does inactive or recovered really mean? Well, when the COVID-19 outbreak first started, the state and Knox County Health Departments were using a 21-day cutoff. This is how long a patient was believed to have been contagious, and after this time, they would have been cleared and considered recovered. 21 days. But with new info from the CDC, the state is changing that definition, and now new data shows that most patients with COVID-19 are not infectious after 10 to 14 days. Looks very different on a calendar, of course. The range of time supports anyone with more severe symptoms that might take longer to recover. Basically, doctors learned more and are updating their guidelines. It's that simple. The state health commissioner adding that other changes will show individual county data snapshots.
While much of this information has already been available in various spots on our website, this new feature puts several helpful data points all in one spot, including individual counties' epidemic curve, cumulative counts for cases, hospitalizations, and deaths, recent versus historical trends, and in-depth data on testing.
A spokesperson with the Knox County Health Department let us know that there may still be some differences between the county's data and the state's because of these changes, but that it will be fixed, we're told, over the next few days. Summer.
Madison, thank you so much. A spokesperson with KCHD also tells us sometimes cases are identified that do need to be later moved to another county. It does take some time, though, for those changes to be reflected in the state's COVID-19 count, which can also make the state and county numbers different at times.